Alrighty, well, good afternoon and welcome everybody. Thank you for joining us today. My name is Andrew Doffney. I'm the Instruction and Outreach Librarian at the New Jersey State Library. And it's my pleasure to present our speaker for today, Tatiana Shields from Capital Health. Thank you so much for Tatiana for agreeing to speak to us today about anxiety. She is a licensed clinical social worker who provides clinical services to culturally diverse client populations with a focus on child and adolescent patients. Through a patient-centered, evidence-based approach, Tatiana offers support and guidance to individuals and families as they undertake major life changes. Her areas of professional interest include intergenerational trauma, anxiety, depression, neurodevelopmental disorders, relationships, and marginalized populations with a focus on collaborative and integrated care. She completed her undergraduate studies at State University of New York at Potsdam in Potsdam, New York, and received her Master's of Social Work degree at Florida International University in Miami, Florida. So again, welcome, Tatiana. Before we jump into the presentation, just a few housekeeping items to go over. First and foremost, we'll be taking your questions at the end of the program, but please feel free to submit them at any time using the Q&A or the chat feature in the Zoom dashboard. Tatiana has provided me with a flyer for youth counseling that they do at Capital Health that I will be sharing in the chat so you can get a little bit of an understanding of what kind of services are offered through the behavioral health specialists at Capital Health. There will be a survey at the end of the webinar, so if you have time, we ask that you please complete it. We always love hearing your feedback. And if you're looking for more information on anxiety, including diagnosis, treatment, symptoms, all of that stuff, the National Institute of Mental Health has a fantastic website. Tatiana has also given me some other links that she will be going over, and I will share them in the chat as she talks about them so that you have a live link to them. For those of you who might not be familiar, this is what your dashboard should look like if you're using a PC or a Mac. If you're using a mobile device, the dashboard may look a little bit different depending on the device you're using, but all of the features will still be there. In the bottom left-hand corner, you have your audio settings. So if your audio does go out, you can check that to make sure that your audio is connected. At any point, if you have any problems, there is a raise hand button here. You can click on that. That will alert me, and I will send you a message in Zoom and hopefully be able to resolve any of the problems that you are having. And lastly, as I mentioned before about questions, you can submit them using the Q&A button or the chat button. Either way, that'll get sent to us and we'll be happy to answer them at the end of the program. So that is everything that I have for you. So it's my pleasure to turn it over to Tatiana.
Okay, hi everyone. I am going to share my screen with you all. Just give me one moment. Okay. And I think you should be seeing my presentation at this point.
Yep, that's good.
Okay, great. So thank you, Andrew. And good afternoon, everyone. So my name is Tatiana, and I am a licensed clinical therapist and a part of the team here at Behavioral Health, Capital Health. And today I'm going to be presenting on cultivating calm in adolescence. And so before we get started, I wanted to give an overview of our practice because we've been open for the past 4 years, and I came on board at the end of 2020 as the child and adolescent specialist. And listed here, you can see a list of our physicians, clinical therapists, case managers, and support staff. And as you can imagine, there's been a large demand for our services, especially over the past few years. And then listed here are our locations. And so you can find us in Bordentown or Newtown. And our general, I don't know what's happening, it's going without me. Our general phone number is also listed here for any further questions or inquiries that you might have about services that we provide. Okay. So I also wanted to give an overview of some of the services that we do provide at Capital Health, and listed here, we have psychopharmacology, which is medication, transcranial magnetic stimulation or TMS, and I myself particularly facilitate individual and group psychotherapy. And essentially we all collaborate to really improve the quality of the lives of our patients. Okay, so as discussed briefly in the beginning, I'm going to be speaking on cultivating calm in children and adolescents. And this topic is really, really close to me because we hear about anxiety a lot, but what is it really, right? So anxiety is an emotion characterized by feelings of tension, worrisome thoughts, or physical changes like increased blood pressure. And children with anxiety disorders usually have these recurring intrusive thoughts or concerns, and they may avoid certain situations out of worry. And similar manifestations can be also found in adults as well. So I'm really going to encourage, as we move through this presentation, that you really start to think about what anxiety might look like for you as an individual when you experience it, because it can become a bit easier to think about it in that way. And it's also important to start having those conversations at home and reflecting on instances where you find yourself or find that you yourself may experience anxiety to better understand your child. Honestly, it's because, like, essentially as a parent, you're always on stage, right? And so our children sometimes model their behaviors after us. And I also want to point out that there's a difference between good and bad anxiety too, right? So for example, if your child is anxious about going to school for a test, is it because they're ill prepared for the test? Or it could be something like, feeling excited. They have a school trip, so they're not sleeping. And so their anxiety presents in that way. And these are common forms of anxiety that children experience and can really be anticipated. But if it becomes more than that, then you may need to connect with a physician or a clinical therapist. And so when you think about anxiety, I would really like for us to know or to think about the fact that, like adults, right, children also have other anxiety disorders, which range from separation anxiety and obsessive compulsive disorder, or OCD, to things like panic attacks. And to help differentiate between an anxiety disorder and a medical condition, you might want to take note of when your child displays certain behaviors or complains of physical symptoms. For instance, like the increased blood pressure, the stomach aches, or something like that, right? Is it happening before or after a certain event? And I would like for us to kind of take a moment to think about what anxiety looks like in our own children. And some of the symptoms include things like behavioral changes, physical complaints like disgust. And you may notice that your child is constantly worried about something. And more recently, what I've seen in our practice is things like, people becoming ill given the state of society with COVID and everything that's been going on. And we'll talk a little bit more about that too. And so other symptoms include changes in appetite, difficulty concentrating, difficulty sleeping, even isolation or withdrawing from friends. And if these symptoms are left untreated, it can lead to your child's anxiety worsening over time or cause significant disruptions in their life. And some signs, honestly, are a lot easier to detect. And children really don't often understand their anxiety or what's causing it. And because of this, they can display a variety of behavioral or physical symptoms that can be hard for parents or other adults to pinpoint. And now I'd really like for us to take some time to review the different types of anxiety disorders that we see, at least in our practice, in children. Yes. Okay, so separation anxiety. This involves an exaggerated fear of being separated from a parent or caregiver. And this type of anxiety is common in young children. And some of the symptoms of separation anxiety are fairly easy to spot. And it really revolves around refusing to go anywhere or be any place without a parent or someone familiar present, refusing to sleep alone, or even refusing to go to school. But if you notice that these symptoms are occurring outside of being separated from a caregiver or you yourself as a parent, there may be something more to assess, as triggers, right, for your child's anxiety can shift. So if you notice a lot of the same symptoms are present, but not necessarily this separation or a specific trigger, they may be experiencing something called generalized anxiety disorder. And so children with generalized anxiety disorder experience excessive and unrealistic worry and fear about everyday things, right? They often anticipate disaster or worst case scenario. And so I'd like for you to kind of think about and reflect on that yourself as a parent, as a caregiver, as a provider. What does that look like in my child? And they also might have physical symptoms, and that might look like headaches or abdominal pain, muscle aches. And on a broader scale, children with generalized anxiety disorder often experience things like irritability and difficulty sleeping too. And the one thing that I really thought was interesting and wanted to share is that sometimes there's impaired concentration, and that can mimic things like mimic or resemble ADHD or a diagnosis of autism. And that may require further assessment to rule out either of those diagnoses. Okay, so obsessive compulsive disorder is another form of anxiety, or OCD, right? And when experiencing obsessive thoughts, which are characteristic of the disorder, it can lead to severe anxiety. And there are also compulsions or rituals performed, and that's also an attempt to reduce the symptoms caused by the obsessions, or reduce the anxiety caused by the obsessions. And so with obsessions, they're the thoughts, images, or ideas that won't necessarily go away and are typically unwanted and extremely distressing or worrying. And some common obsessions that I've seen in my practice among children include extreme worry about bad things happening or doing something wrong, being preoccupied with order or symmetry or exactness, or worries about getting sick or others getting sick. And a lot of children that I've worked with over the past 2 years have named this in particular due to the state of society, like we've discussed, right, with COVID and a lot of families experiencing loss. So with OCD, there are also the compulsions, right? And when we think about compulsions, these are the behaviors that, your child may feel have to be done repeatedly to relieve their anxiety. And really common compulsions that we've seen among children include things like counting over and over again, ordering or rearranging things, or seeking assurance constantly from friends and family. And so I really encourage that you try and take some time to think about your child specifically. Are you seeing some of these behaviors? Are they constantly seeking reassurance? Do they have routines that they don't like to be disrupted? And if so, when and where are those typically taking place? Okay. So panic disorders are more common in older children around their teenage years. And in most cases, in addition to the fear or discomfort, children may also experience derealization or feel like they are detached from themselves, which is essentially depersonalization. And panic disorders are also accompanied by fear of losing control. And anxiety is really rooted in a lack of control. And it can cause things like the physical symptoms we spoke about, the shortness of breath, the nausea, abdominal pain. And again, a lot of these symptoms are very similar. And if your child does experience the physical symptoms, it's really important that you, before connecting with a mental health provider, right, roll out any medical issues that can cause these symptoms before proceeding with mental health. And with regard to mental health, there are also specific phobias. And this really revolves around the idea that children become anxious and worried, but only about a specific trigger, right? Like a thunderstorm or walking across the grates. I'm not sure if many of you have been to New York City, but there's tons of them on the sidewalks. And so things like that. And finally, I want to talk about anxiety in the form of selective mutism, because this is something that I've seen quite often in my practice. And this form of anxiety is honestly really common in children, right? And so selective mutism is really the inability to speak or communicate in certain settings. And that can include specific social settings like in school or within a community. And it really can have a number of consequences, particularly if it goes untreated. And so if you notice any of these symptoms listed here, the inability to speak in school or other situations, especially the use of nonverbal communication, because this is common prior to speaking, right? Before your child's able to speak. And more so, this takes place between selective mutism between ages 2 and 4 is when it's identified, right? So if you notice nonverbal communication, nodding their head, pointing fingers or something along those lines to express their needs, it might mean that their desire to speak is really held back by anxiety, fear, or embarrassment. And it can lead to things like academic problems. And we've also seen it related to low self-esteem as well. Okay. And so when looking further at triggers, right, one thing I think is really important for us to understand and focus on is the fact that new situations can take children out of their routine. And that includes things like getting a new caregiver, recently relocating, or maybe even a new sibling. And we also want to acknowledge that family difficulties, which are normal, right? Like marital problems or financial issues, or even just trying to manage more than one child at a time, can put stress on us as adults and at home, right? And that can have negative effects on our children. But I also want to point out that if you have a family history of anxiety or mental health disorders, right? It's not uncommon that your child might pick up on your reactions to your stressors and model that behavior when they experience their own anxiety. And it's really important to think critically about how you manage your own anxiety and how it can be picked up by your child, and just try to be aware of how you're managing it, due to the fact that we're always on stage and modeled learning is happening constantly. And a lot of the skills that we're going to talk about later, you can apply to yourself in the presence of triggers, which can in turn help your child be better able to manage their own. Okay. And you will hear me speaking a lot about, checking in with yourself as the adult, due to the fact that a lot of our behaviors are modeled by our children. Let me see. And so as we reviewed some of the different types of anxiety, right, we can see that it's not only in the brain, but it's also in the body. And there's a direct connection between our nervous system and anxiety. And that impacts our level of stress, the physical reactions, and the ability to experience pleasure. So, and also to relax, right? So we want to provide just a brief overview, and I'm going to take a few moments to focus on our nervous system. These components of our nervous system. And that's going to include the sympathetic nervous system and the parasympathetic nervous system. Okay. So the sympathetic nervous system is really responsible for your stress response. And I'm pretty sure, we're all familiar with this, right? It activates the fight, flight, or freeze, right? And that's the body's normal response to danger. And this response releases chemicals in the body that affect the heart rate, your breathing, your muscles, and even digestion. So when a child has an anxiety disorder, the fight, flight, freeze response takes place whether there's danger or not. And that's really important for us to know, right? And when that does take place, we want to activate your relaxation response, which is controlled by your parasympathetic nervous system. And it's really responsible for your relaxation response and helps you to prepare to relax and to calm down. And so the skills that we're going to learn focus on the parasympathetic nervous system. How do we create that break between experiencing the anxiety and then responding or reacting to it? Okay. Let me see. Okay. And so I'm also sure that it's really no secret that all of our nervous systems were working overtime in the past few years as we faced COVID. And for children, we saw an increase of anxiety symptoms, most commonly due to like recent transitions, right? So there were schools closing down, there was the idea of all of these new norms like virtual learning. And one of the major things that was noted was the lack of social interaction. And this affected the youth tremendously. And as a parent, I think to encourage you to reflect on what it was like for your child. How did they respond to the shifts in their environment and transitions that took place really like unexpectedly? And it's not uncommon that you yourself might have also had reactions or difficulty adjusting to the new norm, because essentially like the world was on punishment for 2 years essentially, and no one could go outside. And so for children, that's a huge disruption, especially if they're used to visiting family members or going to school and connecting without the use of face masks, or, the changes in the environment. Recess looked a lot different, free time and playtime looked a lot different. And so it's important to think about some of the reactions that, your child may have had during that time. Were they experiencing anxiety? And when it comes to treatment options for anxiety, we really look at pharmacology or medication and then psychotherapy. But the most common way to treat children with anxiety, at least in our practice, is a combination of both the psychotherapy and medication, depending on what your child needs. And that really is established in planning with, you yourself, parents, caregivers, and our physicians and clinical therapists who all collaborate together to come up with a plan that's most effective for you and your family. Okay. And so anxiety in children is most commonly treated with mental health professionals like myself. And some of the modalities that we use as clinical therapists are individual therapy, which is just one-on-one, right? We are able to establish a rapport and build a relationship with the children in order to better identify what their triggers are, what their symptoms are, so that we're able to relay that information to the families, but also come up with a plan that works for everyone. There's also group therapy, right, with a group facilitator, and the participants and the family members are included in that as well. And the family aspect is most important because it really gives us the opportunity to connect with family members and caregivers to get a better understanding of what their child's symptoms are. And essentially, right, you're the expert in your child. You know what it looks like when they experience a panic attack, or what it looks like when they're uncomfortable or anxious, nervous, and worried. And so while you're the expert in your child, we serve to be the expert in the diagnosis, the treatment, and collaborate with you so that we can help reduce the symptoms of anxiety, but also provide healthy coping skills for your child to utilize when they experience triggers. So I would also like for us to take a brief look at the different types of psychotherapy approaches most commonly used to help cultivate calm. And those include things like cognitive behavioral therapy, or CBT, and that really revolves around the idea that our thoughts, feelings, and behaviors all influence one another, right? So when you think about that, the way that we think really can affect the way that we feel, and the way that we feel can influence the way that we behave. And that we see a lot with children too, right? Not that it's just for children, it happens with adults as well. So when you think about it that way, right, the way that we respond to things is affected by what we're experiencing in real time, right? And what we know to do to cope. And this is why I bring us back to the modeling behavior. And so we also have exposure therapy, right? And that is essentially the idea that we expose our children to the things that typically provoke their anxiety in a healthy and controlled manner. And then there's mindfulness-based therapy, and that really combines cognitive behavioral therapy with mindfulness strategies in order to help better manage your child's anxiety, but also get an understanding and help them get an understanding of what their feelings and emotions are that they're experiencing during that time. Okay, so when engaging in psychotherapy, right, to help cultivate calm and better manage anxiety in children, it's really important that parents are also educated about anxiety disorders or the different anxiety disorders. And I encourage that you really try and think about your own involvement, because it allows for the therapist like myself to suggest helpful techniques and allow time for the family to process together some of your child's anxious thoughts and feelings in an effective and healthy way. And through this process, right, a therapist such as myself can help you with things like developing and using relaxation techniques, which is that parasympathetic nervous system, right? And developing positive self-talk to help reduce anxiety by identifying the fears and worries and increasing coping skills. So I'd like for everyone to really try and take a moment and think about what that looks like in your child, right? What are the fears? What are the worries? And what are the things that motivate them too, right? On the other side of that, because it'll be very useful in the exercise that we have coming up. Okay. So how can you help, right? The good thing about this is that there are things you can do at home to help your child learn to manage their feelings. And as I've mentioned earlier in the presentation, one of the best things that you can really do to start is to reflect on your own anxiety and how it affects you. Because of course, right, I can give you a better understanding of what your child is going through, as they typically don't have the same thresholds as adults do. And some tactics might include things like helping your child better manage their anxiety by, oh, okay. Oh yes, by not avoiding what they fear, right? And so while avoidance might offer like short-term relief, it actually reinforces their anxiety or worsens it over time. And so I would really encourage that when you think about ways to provide your child with exposure, that might look like creating positive experiences around whatever it is that your child fears to reinforce their safety and challenge their illogical thoughts. And that brings me back to like the greats in New York, right? Like one of the this example comes to me because I've heard it a few times with walking across the grate, of the fear of falling through or it not being, put there correctly or secure, right? And think about ways that you could ensure your child that they are safe, that that's not going to happen. What are things that you would do in order to challenge those illogical thoughts? One of the simplest things that you could do is walk across it yourself, or, bring them close enough, have them observe someone else walk past it to help alleviate some of the anxiety and fear that they have surrounding that situation. And other tactics include things like offering comfort, right, and modeling positive responses yourself. And that only takes place when we're able to recognize our own anxiety, our anxious thoughts and feelings. And so we can also try like just listening to your child's concerns, but being mindful not to reinforce their fears, right? So instead, trying to help them participate in relaxation techniques that we're going to learn in a few moments, while modeling appropriate non-fearful responses to the source of your child's anxiety. And you can also help them tolerate their fear by allowing them to be gradually exposed, like we were just talking about, right, to the source, kind of like the example I just gave, while using relaxation techniques to calm their fear. And that can really help them learn to tolerate distress and eventually learn that there's nothing to fear. And I know I keep reinforcing this, but it's really important to focus on showing your children that it's something that can be tolerated, calmly tolerated and effectively managed. And it's hard to provide that type of reassurance if we ourselves are dealing with anxiety or maybe responding in unhealthy ways. Okay, so now I'd like for us to talk a little bit about coping skills and some tips for cultivating calm and better managing anxiety in children look like encouraging your child to focus on what they can do in the present moment, right? What can they change, and figuring out what's bothering them or what the trigger is. And then creating space between the feeling of anxiety and the physical response to it. And one way that we encourage this is by practicing breathing techniques. And I'm not sure if you're all familiar with like deep breathing exercises, but that's one of the ways that in our practice, we've seen a lot of success with alleviating some of the symptoms and, you know, activating that parasympathetic system. And so once you are able to do that, right, once you're able to activate the relaxation response, you are in a better position to help your child focus on something that's less anxiety provoking, right? Or implementing what I call a healthy distraction. And healthy distractions have been very effective in my work with children. And really what that looks like is finding something that motivates your child or something that they're really interested in. And so I encourage that you really take a moment to think about things that your child's attention is drawn to, right? Whether it's a favorite show, the tablets are super popular right now, music, headphones and music, I've seen a lot of that, or connecting with friends, right? Talking, there's FaceTime, anything that generates pleasant sensations and feelings can really be used as a healthy distraction. So now I would like for us, if you don't mind, to all participate in a deep breathing exercise, right? And this is an effective way to really create the space between the feeling of anxiety and having a physical reaction to it. So implementing a deep breathing technique. And I'm going to encourage that you all participate with me. And so I'm going to give everyone a brief moment, just to kind of get comfortable in doing whatever you are. If you're sitting down, just get into a comfortable position. If you're standing up and still, that helps. And if you can, I would encourage that you also close your eyes. And so I'm going to do the count, and this is called 4-7-8 breathing, right? And the goal is to inhale for 4 seconds. And during that inhale, you want to recognize that it starts with your head, then your neck and your chest, and then your stomach. As the air enters your stomach, right, as you inhale, your stomach is going to expand. And once you get there, I want you to try and hold it there for at least 7 seconds, and I'll be doing the count. So you'll be able to follow the exercise with me. And when we release after those 7 seconds, I would encourage that you release and you be mindful that it's going to, at first, deflate your stomach, and then it's going to come up through your chest and then your neck, and then the pressure from your head will be relieved as well. Okay. So on the 4 count, we're going to go inhale to your head, and then your neck, and then your chest, and then your stomach, and we're going to hold. And then we're going to exhale from your stomach, and then your chest, and then your neck, and then your head. And if you missed our count, we're going to go again. We're going to inhale from your head to your neck, and then your chest, and then your stomach. And we're going to hold. And then we're going to exhale from your stomach, and then your chest, and then your neck, and then your head. And really the goal of this exercise here is, and how I explain it to our youth, it's like a hard reset for your body and your mind, right? For your nervous system. And I equate that to like the phones, you know, how we have our iPhones or what have you, and you have to do the hard reset, you push those buttons. Essentially, that's what's happening for your body, rebooting, resetting. And it gives you a space between the emotional reaction or the physical reaction and the symptoms that you're experiencing, whether it's the shaking, sweating, increased heart rate, or what have you, the stomach aches, so physical and emotional symptoms experienced by your child. Okay. And so I also wanted to provide an example of a healthy distraction that I typically encourage, and that's through grounding techniques, okay? And for this, we utilize your five senses. And I always encourage utilizing your five senses, because if you're fortunate enough, you have them with you at any given moment, and it's a resource you have in your back pocket, regardless of where you are and what's going on, okay? And so with this exercise, right, the goal is to, in real time, point out five things that you can see. So I encourage that you look around if you're at a desk, if you're at home, and actively point out five things that you can see, four things that you can feel or touch, right? They have to be close by for you to actually physically touch them. Three things that you can hear, two things that you can smell, and one thing that you can taste. And the goal of this is really to reorient your child to the time and space that they are actually occupying, right? Because oftentimes when we experience anxiety, and in my experience with children, anxiety typically takes place when they are concerned about something that is yet to come, right? Something, I always call it like future thinking or forward thinking, right? It takes us out of the present moment. By grounding yourself, you're able to bring yourself back to the present moment. And this is a way that I would encourage we try to do so with our children when you recognize or realize that they are having a panic attack or experiencing anxiety in any way, shape, or form. Okay. Okay. And so I know that Andrew had shared earlier in the presentation that here at Capital Health, we offer individual and group preparation and group therapy for adolescents who struggle with anxiety. And it's a group for children. You know, the age really fluctuates depending on the referrals that we receive, but the program goes for about 12 to 15 weeks. And each group runs for about an hour, hour and a half. And I facilitate these groups, and they do take place in person at the Bordentown office. I think it's important to know that too. And I honestly, Bordentown is the only facility that we run the groups out of, not the Newtown office. And the group really focuses on exposure, which we spoke on a little earlier, and desensitization. And we use cognitive behavioral therapy. And really the participants that take part in this group are asked to share with their group their goals and triggers. And they identify those things through the individual prep work that they do with myself. And so we utilize cognitive and behavioral interventions to address specific problems, right? And they're expected to practice the skills in between sessions. And this is why it's so important for family or caregiver involvement, because they're encouraged to practice the skills throughout the week at home so that the skills can be transferred into the home or into a school setting, regardless. And the group does have 4 different phases, and I'll go over them briefly, right? So the first phase is really addressing what anxiety is in a child-friendly way, right? So they have an understanding or a better understanding of why they're experiencing the symptoms that they are. And then the second phase is more so focused on exposure, and we discussed that a little bit too. And desensitization to their trigger. So what is it that triggers you? What are the thoughts that come up, and how can we challenge those thoughts? What's a healthy way to do so? And the third phase is where we learn the skills to activate our relaxation, right? The parasympathetic nervous system. And we spoke about that as well, right? We want to activate the relaxation. And then the fourth phase really involves repetition, right? Reinforcing use of effective coping skills, as not every coping skill is going to work effectively for each child. And this is why it's so important to have that connection with the family so that we know what's effective, what's working, what's not. And we're very flexible. So if at any point, we provide feedback or suggestions that aren't working, we always recommend, let us know immediately, because we can change it, because it really depends on what works for your family system, what works for your child. Okay. Oh, and we also have additional resources, yes. And so this piece, with Performed Care, right, they offer services for children and families, and you can contact them. Everyone's contact information is listed here, and they offer services for children and adolescents who are in need of services for children who have like behavioral or emotional difficulties. Very similar for the youth helpline, and the youth helpline is actually open 24/7, 365. It's a great resource. And then we also have the Carrier Clinic, right? And they run groups for children up to age 12 or 14. And so you can also reach out to them in the event that you are or your child is experiencing difficulties with anxiety. They also have support groups as well for children. Okay. Okay, and that actually concludes the presentation for today. So I will open the floor up for any questions that you might have. And I think they were put into the chat, so give me one moment. Let me see. Okay, so with regard to adult programs, yes, we do have adult programs for, well, we have individual services for adults, and we also have groups for adults here. And I think right now we're running, not even I think, I have the flyers. We're running a group currently for a caregivers group. So individuals who are caring for loved ones who are, you know, in hospice or, you know, have a severe medical condition. We have a support group. We have support groups for mood disorders and depression as well. And in May, we're going to be starting the group that focuses on executive functions for adults. So adults who have a neurodevelopmental disorder of any type. There's a program running for that as well. Okay. Let's see. That's okay. I'm going through questions. Oh, okay. Okay, I have an employee with anxiety. Oh, okay. Okay. Yeah, a lot of the skills discussed in the symptoms are transferable to adults as well, because I see a lot of people had noted that they were looking for information with adults. Okay. Do we have any okay, so with regard to sleep disorders, I know with our psychiatrists here, sometimes they recommend like having a sleep study, but also addressing anxiety and triggers in individual therapy. And I'm not sure, let me see. If you are interested, I know our contact information is going to be shared as well, and you could reach out to our reception line and they will get you connected. They can give you that information on how to get connected with a psychiatrist if they have any availability. And I think right now we're scheduling out at least a month. So I would encourage you to do that too. Let's see. Okay. I don't see any more questions here.
It looks like there's a couple questions about what medications work best for anxiety.
Okay, so with regard to medication, I'm not a prescribing physician. I will let you know that. And so for that information, I would recommend connecting with our psychiatrist for what medication, because it's not going to be the same medication depending on what your symptoms or your child's symptoms are, right? Sometimes, they prescribe stimulant medication, which can worsen certain symptoms. If you have a child who can be emotionally reactive, or you yourself find that you can become aggressive or upset, they wouldn't recommend that. And so it really depends on you, the individual, because medication is going to affect you differently than the next person. Oh, okay, clinic, okay.
Alrighty, well, any tools to help focus?
So with focus, can you explain a little more about what you experience with like your difficulty with focus? Are they able to speak, or is it all through?
It's all text.
Oh, okay. Okay. So with difficulty focusing or concentrating, one of the things that I have seen be really successful is to create built-in breaks, no matter where you are, right? Like if you find yourself easily distracted, block out time to give yourself the opportunity to do that thing. Like for my kids and a lot of my adults, scrolling is a really big thing, right? You go to check something and then you find out, 20 minutes later, you've been scrolling. Blocking out 5 minutes or so just to check your notifications, give yourself 5 minutes or so to scroll or to get up and take a walk, then to come back and refocus. Works well, because then you have the opportunity to do that thing. You're not missing out on it. And because it's a specific amount of time allocated to said thing, when you return, essentially you feel better focused, better able to continue with the task at hand, would be my recommendation. Yes. And we still have a few minutes, so. Okay.
Well, looks like any help with keeping positive if something is hard to deal with and anxiety happens.
Okay, so this is one of the things that we spoke about, the healthy distractions, right? That is a great way to remain neutral, and if not neutral, more elevated. And so I would encourage, and I'm not sure if you're familiar with like self-care, right? And similar to like blocking out time to attend to things that would maybe distract you, you can also block out times to do things that generate pleasant sensations and feelings, right? And so if you are experiencing anxiety, or if you know that you experience anxiety, trying to implement things throughout your week or throughout your day that generate pleasant feelings and sensations, so that you're already starting out at an elevated state. And so if something does take place that causes your mood to shift or change, right, your mood is not going to dip as low as it typically would, because you have experienced those pleasant feelings and sensations. And so if you're at an elevated state and you've just watched a great movie, or you went for a walk, or you exercised, and you experience something that's anxiety provoking, you won't dip as low, your mood won't dip as low, and it's less intense. These symptoms become less intense the more positive and pleasant sensations that you experience throughout your day. So I would really encourage trying to engage in self-care, and whatever that looks like for you, because that differs for other people too.
Alrighty, well, I think we can go ahead and end it there. So thank you so much, Tatiana, for speaking with us today. This program is being recorded, so everybody who registered will receive a link, and I'll also include Tatiana's contact information in case you have any follow-up that you would like to speak with her about. So again, thank you so much for speaking to us today, and everybody be safe, be well, and hopefully we'll see you soon.
Thank you so much. Bye.